Welcome to the channel, guys. Today we're diving into a topic that's a household name when it comes to tackling everyday aches and pains: paracetamol 500 mg, commonly known as Panadol. Whether you're reaching for it to ease a headache, fever, or just looking for a reliable pain reliever, this video has got you covered. We'll be exploring its uses, the right dosage to ensure effectiveness without risk, potential side effects, and important contraindications you need to be aware of. Stay tuned for a comprehensive guide on paracetamol, your go-to solution for common ailments. Now let's jump right into the world of paracetamol. Firstly, we will talk about two uses of paracetamol. Number one, we have pain relief. Paracetamol, also known as acetaminophen, is a widely recognized and frequently employed medication for the relief of mild to moderate pain. Its efficacy in addressing a spectrum of discomfort, ranging from headaches and toothaches to muscle aches and joint pain, has made it a household staple and a go-to choice for individuals seeking effective pain management without the need for a prescription. Paracetamol operates by inhibiting the production of prostaglandins in the brain, which are responsible for transmitting pain signals and promoting inflammation. This dual action not only helps alleviate the immediate sensation of pain, but also contributes to reducing inflammation, making it a versatile solution for a variety of painful conditions. The convenience and accessibility of paracetamol contribute to its popularity as an over-the-counter analgesic. Additionally, the relatively low incidence of adverse effects when used within recommended dosage limits enhances its safety profile. However, it is crucial for users to be mindful of potential interactions with other medications or pre-existing health conditions, emphasizing the importance of consulting healthcare professionals for personalized advice on pain management. Furthermore, the broad spectrum of conditions for which paracetamol is effective underscores its role as a reliable first-line option for pain relief. Whether the discomfort is associated with daily stressors like tension headaches or more persistent issues like joint pain, paracetamol's ability to provide relief without causing significant side effects positions it as a valuable tool in promoting the overall well-being and comfort of individuals facing diverse pain challenges. Number two, we have fever reduction. Fever reduction is a critical aspect of managing various health conditions, and paracetamol stands out as a reliable medication for this purpose. This over-the-counter drug is known for its ability to effectively lower elevated body temperatures associated with infections or other illnesses. By targeting the hypothalamus in the brain, which regulates body temperature, paracetamol helps to modulate the release of prostaglandins, chemicals that contribute to fever and inflammation. As a result, it not only provides relief from the discomfort caused by heightened body temperature, but also aids in creating a more conducive environment for the body's natural healing processes to take place. The versatility of paracetamol in addressing fever makes it a staple in households and healthcare settings alike. Whether the fever stems from a common cold, flu, or other infections, paracetamol's widespread availability and established safety profile make it a popular choice for individuals of various ages. The ease of access to this medication allows for timely intervention in managing fever, contributing to an improved overall patient experience during times of illness. Now let's talk about the dosage. The typical adult dosage ranges from 500 milligrams to 1,000 milligrams, and it is generally recommended to be taken every 4 to 6 hours as necessary. This dosage can be adjusted based on the severity of pain or fever, but it's crucial not to exceed the maximum daily limit. The maximum recommended dose of paracetamol for adults is 4 grams. 4,000 milligrams within a 24-hour period. Exceeding this limit can lead to serious liver damage and other adverse effects. Patients are advised to carefully read the product label for specific instructions or consult with a healthcare professional for personalized guidance. It's important to note that exceeding the recommended dosage, whether intentional or unintentional, can have severe consequences, emphasizing the significance of responsible medication usage and seeking medical advice when uncertain about appropriate dosing. Now we will talk about side effects of paracetamol 500 milligrams. Despite its widespread use and general safety profile, paracetamol, like any medication, may be associated with certain side effects. Among the common side effects reported by users are nausea and upset stomach. These symptoms are usually mild and transient, resolving on their own as the body adjusts to the medication. It's advisable to take paracetamol with food or a glass of milk to minimize the likelihood of stomach upset. However, if these side effects persist or become severe, it is recommended to consult with a healthcare professional. Individuals with a known allergy to paracetamol or any of its components should avoid its use and seek immediate medical attention if they experience any signs of an allergic reaction. It's crucial for individuals to be aware of their own medical history and potential sensitivities to medications to mitigate the risk of adverse reactions. And lastly, we will talk about contraindications of paracetamol 500 milligrams. Paracetamol is contraindicated in several scenarios, and individuals should exercise caution and avoid its use if they fall into certain categories. First and foremost, individuals who are allergic to paracetamol or any of its components should refrain from using this medication. Allergic reactions can range from mild symptoms like skin rashes to severe conditions such as anaphylaxis, necessitating immediate medical attention. Another critical contraindication involves individuals with severe liver disease. Since paracetamol is metabolized by the liver, those with compromised liver function may be at an increased risk of adverse effects, including liver damage. Excessive alcohol consumption is also a contraindication, as combining paracetamol with alcohol can exacerbate the risk of liver damage. For pregnant or breastfeeding individuals, it is advisable to seek guidance from a healthcare professional before using paracetamol. Thank you for tuning in to our comprehensive guide on paracetamol 500 milligrams. We hope this video has been informative and helpful in understanding the uses, dosage recommendations, potential side effects, and contraindications associated with this widely used medication. If you enjoyed this video and found it helpful, don't forget to give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss our future content. Remember, it's crucial to follow the recommended dosage guidelines and consult with a healthcare professional if you have any concerns or questions about the use of Panadol, especially if you fall into contraindicated categories. Stay informed, stay healthy, and we'll see you in the next video. Take care.